Hi, I'm Dr. Ali, a cardiologist with 3 decades of experience in education. Today, we're going to continue discussion of the patient who presented with sudden onset shortness of breath, uncontrolled hypertension, found to have severe aortic stenosis. If you think about aortic stenosis itself, a lot of times it is due to degeneration of the valve with time, or it can be rheumatic heart disease, particularly in the Asian countries. The most common congenital abnormality, bicuspid aortic valve, it affects 2% of the population. About 50% develop mild stenosis by age 50, or it can be genetic and inflammatory like lupus, rheumatoid arthritis, high lipoprotein little a levels, Fabry's disease, etc., previous chest radiation. Now, basically, it acts like a pressure cooker. The stenosis restricts the valve opening, physically obstructs the blood flow during systole. There's compensatory hypertrophy of the left ventricular wall, increases wall stress and thickens the wall. And when it decompensates, the heart goes into dilatation and reduced ejection fraction. They are symptoms that happen commonly. There's a 10 to 20-year asymptomatic latent period because the body has a large capacity for compensation. There's a large amount of time where stenosis worsens, but the pressure difference across the aortic valve does not. The presenting symptoms are often dyspnea in 50% of patients, syncope in 35%, and angina in 15%. Angina is because the oxygen demand of the massively thickened LV exceeds the available supply, not necessarily due to blocked arteries. Now, some people present with Hades syndrome, high shear stress, shreds the high molecular weight, von Willebrand factor, and causes an acquired bleeding disorder causing GI hemorrhage. Now, all of these have mortality implications. Once you have angina, the average survival is 5 years, syncope, 3 years, heart failure, 2 years. There's more than 90% mortality within a few years of symptom onset without intervention. The intervention involves mechanical fix with valve replacement, either with TAVR or with SAVR. 13% of patients with severe aortic stenosis, death occurs suddenly without prior warning and is sudden cardiac death. Thanks for watching. More to follow.